On the East Coast, the pride and joy of Canada's COVID-19 response, the Atlantic bubble, has popped for now. The bubble allowed residents to travel freely between those 4 Atlantic provinces without the need to self-isolate. That ended this week. Joining me now from his office in St. John's, Newfoundland and Labrador Premier Andrew Furey. Nice to see you, Premier.
Good morning. How are you?
I'm good. So tell me how difficult a decision that was now to leave the bubble and require people to try and get your cases under control. How difficult was that?
It's a really tough decision because we had such pride in the Atlantic bubble and it was working so well. That was a tough decision, but it was one that we based on evidence, and we wanted to ensure that we're always making public health decisions based on evidence and not on politics. So this was one that we reflected on over the last weekend and saw, for me in particular, what was most concerning was some of the non-epidemiological spread, or the so-called community spread. Mm-hmm. That was most worrisome for me, and so that led to the tough decision and some sleepless nights over the weekend, but I think it was the right decision, the most prudent decision, and frankly the most responsible from a health perspective for Newfoundlanders and Labradorians.
How much of this was coming, I guess most of it was coming from outside the community, but was any of it due to some of your rotational workers, the people that have to leave the province in order to work for periods of time?
Yeah, we made the decision based largely on other jurisdictions and what we were seeing throughout the Atlantic provinces. Right now, Newfoundland and Labrador, although we are seeing small increases in case numbers, we've been pretty lucky, and that's in large part due to the public health guidance and, frankly, how vigilant Newfoundlanders and Labradorians have been. But with respect to rotational workers, all our cases that are coming into the province have been travel related, and we've been lucky enough to be able to epidemiologically link them back to an index case. So we're continuing to be vigilant about that. I'm incredibly empathetic to rotational workers and the stress and strain and anxiety that this must cause in their family life. And to that point, we have provided opportunities for them to shorten the quarantine. Of course, the gold standard for this has been the 14-day quarantine. So we're looking at tools and measures to try to shorten the quarantine. So we have given rotational workers the opportunity, if they're not coming from an outbreak site, to be able to shorten their period of quarantine with a test. The issue with the test, of course, is, as we all know, it's not foolproof, and we're evaluating that with the evidence as it becomes available.
I wonder if, because of that, and because so much of your province relies on that kind of work, whether you might consider making rotational workers a priority group once the vaccine becomes available.
Well, I think it's most important to triage the priority groups according to science and evidence. And we know now that there are populations and segments of the population that are more impacted than others with respect to the COVID-19 in terms of medical illness and the mortality and morbidity associated with it. So I think it's very important and crucial that we follow the evidence there. And I would strongly argue for a pan-Canadian guideline on who gets the vaccine, with obviously some modifications for local jurisdictions, but people like people who live in long-term care facilities, people who are over the age of 70, people with comorbidities, Indigenous groups, vulnerable people who we know that we need to protect, and it's incumbent upon us when distributing this vaccine to protect them first.
We heard a lot of frustration from some premiers this week about not getting enough information from Ottawa around vaccines, and insistence that the vaccines be distributed per capita. First of all, is that important to you, that you get it per capita? Do you feel like you are not getting all the information you need to make good decisions?
No, I've been very comfortable with the information that's provided by the Intergovernmental Affairs Minister, and we had a good, healthy, informative call with the Prime Minister on Thursday, where he explained the country's readiness in terms of vaccine distribution, vaccine and supply chain management. And I think that we need to be working collectively as a country, as Canadians. This is a disease that knows no boundaries. So in terms of jurisdictional arguments, I'm less concerned about that. I'm more concerned about working in a collaborative fashion to ensure that Canadians get protected and the most vulnerable within the Canadian population are protected first and foremost.
Would you, as some of the other Atlantic premiers have said, would you be comfortable saying we'll wait if there are hotspots in other provinces, like we're seeing, for instance, in Alberta?
Well, I base that on science, and I think the fairest way to kind of tackle this, as you suggested in the previous question, is perhaps per capita. It's not foolproof, but you really need to look at the burden of the vulnerable if you're going to truly come up with a formula that distributes this in. Sure. In a triage fashion. It should never be just per capita, albeit that perhaps is the formula that we're going to land on for simplicity of logistics and operations. But if you're going to come up with a more creative formula, it certainly would be one perhaps that should be based on the burden of vulnerability as opposed to the raw numbers of outbreaks, because we know that can change, right? So sure. if you're trying to protect those that don't have it, not that those that have it.
Right. I want to ask you about the economic update tomorrow, too. I'm sure everyone will be watching that closely, as well as yourself. And your province has been hit very hard, obviously, because of the pandemic, but also because of the decrease in offshore oil royalties. You posted a $1.8 billion deficit. So you're in some trouble, Premier, and I know that you're working on that inside the province. What is needed from federal government at this stage that could help you in your province? Would it be to target some particular sectors and industries?
Absolutely. Tomorrow I'll be watching with great interest as the fiscal update occurs. And I think like every Canadian, I'm looking in particular for them to continue some of the good work they've done. And I think that they do deserve some credit, a lot of credit here in terms of providing economic and social stability in the face of crisis. But from my particular province, and I'm sure this is consistent with Alberta and Saskatchewan in terms of an energy sector, mm-hmm. we're looking at sectors that could be supported in other ways. So I'll be watching for language surrounding the energy sector. I'll equally, though, from a social lens, be looking at language surrounding the promise for childcare. It's something that's near and dear to our heart, and I believe it's a good tool to emerge from this economic crisis. And to that effect, our province has introduced $25 a day daycare, despite the troubling fiscal times we're in, because it is a good economic investment moving forward.
Do you have a sign that that's coming, Premier? Have you been told to expect something around childcare tomorrow?
No, I'm just building on the language from the speech from the throne.
Right.
So
okay.
I'm taking the speech from the throne and looking for nuggets that I think that.
Well, I know you're well connected, so I did want to ask. I only have 30 seconds, but a lot of people in Canada probably don't know you're also a doctor, and I wonder if you found moments over the course of this pandemic where you wanted to just, put down your laptop and your pens and your phone and head into the hospital.
I have indeed, and in fact, during the leadership campaign that occurred as this was happening, I was on the front lines of the COVID unit here in St. John's. Luckily, there was low numbers, but I saw firsthand in those moments of anxiety where no one really knew, and you saw the nurses and the orderlies and the staff and the doctors showing up, not knowing what to expect in full PPE. I was there with them on the front lines for several weeks, and there have been many times where I watch as I drive by the hospital every day and wonder, should I be laying down the MHA pin and picking up the stethoscope again for the short term. But I'm very comfortable and confident that we have some of the best healthcare workers across the country here in Newfoundland and Labrador, mm-hmm. and I trust them with my family, and I know they're doing a great job.
Okay, Premier, I've never met you before, so this was it was a nice first meeting, and I hope we can talk again soon. Thank you so much.
Me too. I'm a big fan. First-time caller, long-time listener.
Fair enough, Premier. Thank you. I appreciate that. Have a good Sunday. That's Newfoundland and Labrador Premier Andrew Furey.